3 numbers, 988. It's the free 24/7 suicide and crisis prevention hotline.
Yeah, okay. What area do you live in? We're trying to give them whatever we can to get them, what they need to point them at least in the right direction on where they need to go.
Since its launch nearly a year ago, the 988 mental health and suicide prevention line received more than 2 million calls and texts. The old line is a little bit clunky and hard to remember, but 988 is easier, just like 911.
It is a life-saving. It's completely has changed the landmark. It's completely changed access. Everybody can remember 3 numbers.
It's not specific to just suicide crises anymore. It also includes mental health and substance use crises. So this is really expanding broader access of care.
The CDC says in 2020, nearly 46,000 people died by suicide. That's 1 death every 11 minutes. And experts are hoping open lines like this can help.
Around this time, I had a friend to commit suicide. I'm sorry. I get emotional when I tell this story. Still looking for closure, still wondering why. How did I not know? Why didn't she call?
Suicide affects not just the individual, but their families and communities. 4 years ago, Connor Eyre lost his big brother to suicide.
It tears a piece of your heart away. It leaves a hole there that can't be filled, because it is a human life that we have lost.
Suicide is the 12th leading cause of death for Americans, and it affects all age groups. In Milwaukee, school counselors have seen an alarming trend in children.
What we're seeing, I think, that is the most concerning is younger kids that are actually harming themselves. And research shows the risk between, kids who engage in self-harm behavior having, an increased risk of suicide later on in their life.
Unlike the previous 800 number, 988 users can also text 988 for support. Experts say that could broaden access for younger populations.
There may be times when they are in situations where not only do they not want to reach out via phone, but they may not be able to. Sometimes a student may be in crisis at school and they need to reach somebody via text.
Missouri's Department of Health partnered with schools and youth organizations to get the word out.
So I have a message for anyone out there who might feel like you need help and you've got nowhere left to turn. You're not alone. It's not too late. Dial 988.
Despite its success so far, long-term funding for the 988 line may be in jeopardy in some states. The federal government mandated the helpline, investing millions of dollars. But just like 911, states are responsible for operations and funding.
Thank you for calling Crossroads. This is James. How may I help you?
The National Alliance on Mental Illness says 29 states have passed legislation to fund any of the core crisis services. Those services include call centers, mobile crisis teams, and community-based treatment centers. Sandoval, Scripps News, Chicago.